Hey Foot Geeks fans, I'm here today with Rahim Valli from Sacred Ground Health. He's an RMT, and we want to talk about how foot positioning can help improve your entire body alignment. So we want to talk about the tripod of the foot. Now what exactly does that mean when we talk about the tripod of the foot?
The tripod of the foot. So if we look at the hand, you've got the ball underneath your big toe here. You got the ball underneath your fourth and fifth toes right about there. Then you've got the heel bone, which is one bone. And I like to think of the heel as having two support positions, even though we're talking about a tripod here. I almost like to think of it as like a quad pod, if we can.
Okay,
use that
sure.
term. Okay, so you've got two spots on your heel bone where you can potentially put weight. Okay, so what you want to aim to do is you want to have balance between the heel bone and the ball of the front of your feet, the forefoot, and you want to create this tripod or quad pod, as we call it, of support for your foot.
Why is it important to position ourselves properly from the ground up?
Yeah, it's a really good question. So I have an anecdote from a instructor at a massage college that always stays with me. You know, he had this patient that came to see him, and she was complaining about some pain in her neck. And he went and did a pretty thorough assessment, and he found that the problem was actually from her ankle and her feet.
Yeah.
And she stood all day for work, and there was a lot of strain on her feet, and yet she wasn't necessarily feeling the symptoms there. The symptoms were showing up in the neck, and that blew me away. And he explained that the neck is the most mobile part of the spine, and so if we have any problems that are showing up if we have any problems that exist in other parts of the body where the cause might be, the symptoms may not show up in those exact parts where the problem is. The symptoms may show up in other places in the body.
Yeah.
So here she is complaining about neck pain, getting a neck massage, no problem. But the problem's not being addressed. The problem's not going away. It continues to persist. Meanwhile, she gets a treatment done on her foot, and within 20 minutes, half an hour, neck problem's gone. So it's really understanding our body as a whole rather than as the sum of its parts, so to speak, right?
Yeah, and that's exactly what it comes down to. Is like if you treat one area of your foot, it may not necessarily, it may take the pain away in the foot potentially, but in some cases, maybe the pain isn't coming from the foot, or the pain may be coming from the foot but is showing up elsewhere. And I think a lot of it has to do with the fascia as well, and how everything is connected to the muscular structure and how it interacts on your bone structure. But the interesting part, if you look at the fascia itself, like if we address, for example, plantar fasciitis is one of the symptoms that we see quite frequently in our stores. It's something that in some cases maybe stemming from tight hamstrings, or maybe it's a back issue, right? This is why some medical professionals will say that, hey, the pain is not really coming from your foot, it's coming from this other part of your body. And the interesting part, if you look at the fascia itself, you have fascia that runs up and down the front of your body, and you have fascia that runs up and down the back of your body. And the plantar fascia is attached to that, so it basically runs along the backside of your heel, comes up the calf muscle, and then through the back and in the neck area, and even attaches on the top of your forehead right here, right? So what's interesting is that because of this interconnectedness of the body, you may, as a result, end up with discomfort in other parts of your body that you aren't aware of. So keep that in mind when you're trying to treat certain symptoms. That the symptoms that you're experiencing aren't necessarily coming from the part of the body where they happen, but they may be a direct correlation to something else that's going on in your body in terms of positioning. And that's why we want to talk about foot positioning today and how to align yourself properly. So stay tuned for the video in the end, where we're going to show you and visualize for you how to position yourself well from the ground up. And Rahim is going to do that in just a moment.
So we're going to start with the foot and ankle positioning. And what's important over here, as we talked about earlier, is to make sure that you have your weight evenly distributed between the two balls of the feet and the heel. So I'm going to show you on my own foot what that looks like here, okay? So you've got ball number 1, bone number 2 roughly there, and the heel, and I was talking about the heel, even though it's one bone, you kind of want to think of it as having 2 spots for you to support your whole leg, okay? So I'm going to stand sideways here. I'm going to move my foot into the camera so you can see what that looks like. And what I want you to pay attention to and notice in your own positioning is whether you tend to stand more on the inside of your foot, more on the outside of your foot, more in the front, or more in your heel. And the first step is really to notice what is going on both the right side and the left side. So you might actually be standing very differently on each foot, and that's something to be really aware of, and that's something that's really important to be aware of. And so as you start to become aware of how you're standing, I want you to start to just, move your feet around. So I don't know if you can see my knees here, but just move your feet around a little bit here and just get a feel for what it feels like to have your weight moving from the 4 different points, or the 3 different points that we've talked about, okay? And once you start to do that, you can just go counterclockwise and clockwise about 4 to 5 times. And as you finish that rotation and you finish your final rotation, just settle back down into your body. And ideally, where you want to be is to put a little bit more weight on the back, on the heel bone, and you'll notice as soon as you do that, your whole body will start to move back as well. And that heel bone is a big bone. It's meant to take more weight, and we tend to sometimes stand a bit more forward or a bit more inside. So really focus on trying to get into your heel bones a bit more and distributing the weight of your body more on your heel bone and up the rest of your body. Next, we're going to go up to the knees. Now with the knees, I'm going to be very mindful with my language here and very specific. A lot of times we talk about bending the knees. What I'm going to invite you to do instead is to soften your knees. And there's a huge difference. Bending your knees, I'm going to turn sideways so you can see this, okay? Bending your knees, most people are going to do this and they're going to over-exaggerate. Now that's not going to be very healthy or helpful either. So what we want to do instead when we talk about softening the knees is I'm going to exaggerate to somebody who might stand with locked knees, and you can see that's not very good or healthy either. And it has repercussions up the rest of the body, which we will come to. And so when we soften the knees, notice that there's just a little bit of softness there. And what I invite you to do here is to just create a little bit of bounce. Get into your toes a little bit, get into your heels a little bit, do a bit of that rotation again like you were before, and just bounce on your knees a little bit, focus on softening your knees a little bit there. And you'll start to feel a bit of a difference between having either locked knees, exaggerated knees, or exaggerated knees, to having just more soft knees and more spacious knees. Okay. The other thing to know about the knees is the anatomy. Okay, so you've got the femur, which is the big bone. So you've got the femur, which is the big bone here, and then you've got the tibia, which is the big bone here. These 2 bones meet on top of each other, and they form a joint together, roughly like that, we'll say. And then you've got your kneecap, which is almost a rounded bone. It sits on top, and it doesn't actually connect to either of these bones here. So it's a separate bone that's controlled more by your muscles. So when you're thinking of softening your knee, you're really focusing on these 2 big bones of the leg here, and feeling how they move. So we'll go through the visualization a little bit later, but for now, just focus on softening that knee. Okay, now that we've got the knee softened a little bit, we're going to move up into the hips and pelvis. And when you get up to the hips and pelvis, let's turn sideways here. When you get up into the hips and pelvis, if your knees are locked, you can notice that there's also a little bit of a tilt in my pelvis, and I tend to stand, a little bit more forward. Now, the other thing that we tend to do is we tend to arch our back a little bit more. Having the knees locked contributes to arching that back. So soften your knees, move up into the pelvis, and when you're at the level of the pelvis, you want to think of your tailbone. So if we can use my hand as a model for what the tailbone looks like, it's roughly a C shape from back to front, okay? And the bottom part of the tailbone looks like an arrow upside down. So what you want to imagine is that you want to tuck that arrow, you want to tuck that tailbone under a little bit. I'm just exaggerating here for the sake of giving you a visual. And when you tuck that tailbone, what that automatically does is a couple of things. Is it tilts your pelvis into a better position over top of your legs. It brings your belly towards your spine, closer to your spine, and it flattens your back out a little bit more. So now you've got this foundation of support for your upper body and for your spine happening right from your pelvis down to your ankles. So let's put together everything from the feet to the knees into the hips, and let's see if we can get that to help you start to stand a little bit better, and at least to become better aware of how you stand. Okay, so we're going to start with just that. I'm going to just do it twice. Is just circle twice this way, circle twice this way, settle back into my heels, and then go up to my knees and soften my knees. And as I'm softening my knees, moving up into the pelvis, tucking that tailbone, and you can contract some of your hip muscles and your abdominal muscles if you want to, but it's not necessary. The whole point is just to focus on your skeleton here. So tuck that tailbone, hips are back. Nice deep breath, just to help everything to ground and to become a bit more solid. And there we have it.